we understand nurses are the heartbeat of healing, but we'll definitely get into that in a bit. Just to remind you about what's happening out there traffic-wise. Well, one or two impediments being attended to. That's around Ojoduberja, where a trailer ran into the median, and that has, blocked the entire corridor as we have recovery efforts in progress. Traffic has backed up beyond Berja, for now. So be on the lookout. And we're still yet to get the latest regarding the broken down truck that had a gas problem ascending the Gomu Bridge inward costing. I hear it's receiving attention and it's affecting vehicular movement. But let's keep our fingers crossed. More news will be coming. We'll be serving you more in-swingers as we begin the conversation. All right, so we're delving into the world of Rjolad this morning on the first half of Your Side Mirror. If you're just connecting with us, have in mind we are live on YouTube, Traffic Radio 961, and on Facebook, Lagos Traffic Radio 96.1 FM. I have the Chief Nursing Officer for Rjolad Hospital. She's Joyce Ikechi Mark. Yes, Chief Nursing Officer, Rjolad Hospitals. Good morning, and it's a pleasure to have you this morning.
Good morning for having me. Thank you so much.
Yes. Okay, so October is 1 month at which we spread awareness about cancer.
Yes, please.
So what actually inspired Rjolad Hospital to focus this year's campaign on celebrating nurses?
Okay, so first of all, let me give you a little bit of insight into what cancer is all about.
All right.
So cancer is a very complex disease condition of abnormal cell growth, and it spreads to every part of the body through the either lymphatic system or the blood cells, and it is no respecter of man, race, age, time, season. So it doesn't care who you are, your money, your whatever status it is. So it's a very terrible thing, and that is why we take it really personal at Rjolad to make sure that we will continue to give awareness. We continue to tell people how to take care of themselves, the preventative measures, the treatment journey, and everything concerning cancer. So that is why we're here since 1st of October to date. We'll be doing everything, doing outreaches, and to churches, to different organizations to bring awareness, even in your radios.
Yes, of course. Yeah. So how's the response been from the people you've reached out to?
Oh, it's been wonderful, because we actually also focused on breast cancer. So we'll be doing mammogram for people, and we've been doing a lot of discount for them, and we've gone to different. It's a massive. We didn't even know Nigerians are really going to be responding, because cancer is really ravaging everybody right now, and it's something nobody is. We don't know how you're going to cure it. So now we're telling people you can do better, you can live better life, you can prevent this, you can do more exercises, you can live well, you can take more food, better, energy and everything. And people have been responding. It's been awesome.
So how would you rate the spread of cancer in this part of the world? Is it something that's spreading rapidly? Yeah,
it is really spreading rapidly. For instance, if you ask me when I was in school some years back, 20 years back, it wasn't like that. But some like 10 years ago to date, it's been so massive. And it's not limited to anything. It's cancer of the skin, breast, lung, everywhere. Prostate is even so much everywhere. And it's been really spreading. And it's not even limited to anybody. So we see a lot of them in children.
So it's not gender-based?
Yeah, it's not gender-based. It's not even like age-based or anything.
So looking at those coming down between, when it comes to gender now, which gender comes down with cancer even more? Is it the male gender or the female gender?
I will not say this. It depends, because cancer has no particular. You don't have a particularity, for instance. So when you it goes everywhere. So you have the skin, you have the prostate, but when you want to classify according to gender, you can now say, prostate, more of men. Breast cancer, more of women. So you look at it, the lung cancer, more of in those that smoke and live that kind of lives and everything. So it depends on your lifestyle. That's why we are saying lifestyle modification and your diet, it plays a whole lot of roles. And then preventive measures. Have you all gone to do your wellness?
Awareness, check.
Have you done your wellness this year?
Okay.
Have you all gone? I'm asking now. Starting from here, charity begins at home. So this is my home also.
Absolutely.
So I'm asking, have you gone to do your own wellness? And we do that. And we're doing that for you also. People have been coming. So please come.
Okay. So some people say, people from 40 years and above are more liable to come down with cancer, any form of cancer. Now, would you say that's a myth or a fact? Or is it to say children don't come down with cancer as well?
No, what they are trying to say is that it depends on the kind of cancer.
Okay.
All right. So it doesn't matter your age. Like I say, is a no respecter of age or anything. Children, yeah, we have seen a lot of kids coming down with cancer. So it doesn't even matter your age, in their, toddlers, everybody. So it doesn't even matter. So, and that is why for you to have a better future, why not prevent it? Or, most of us parents, let's start, awareness from our kids in our schools, in our infantories and everything. Let's start telling them the best things to do to prevent the future, cancer. It doesn't matter. It goes to everybody.
Okay, so let's get into, caregiving for cancer patients. But first, just like I threw the question, what inspired Rjolad to focus on, celebrating nurses in this case? Because they're the ones that, take care of this patient and all. So tell us, what inspired this?
Yeah, so Rjolad is inspired. We are all inspired to do that. Why? Because nurses are the heartbeat of every healthcare. It's been established. Okay, so let me give you a little insight. So in healthcare, we have people we call order givers, right? That is, you give order. Okay. Then we have order dispensers. So order givers are the doctors, right? Order dispensers are the pharmacists.
Okay.
And we are the nurses. We serve two roles.
Oh, tell us.
We are order takers and we are order administrators. So it's not only that we take the order and then we administer. You give the order and you go home. You go and sit down. Then we take this order and we administer this order. And we make sure that the patients get the right doses, get the right drugs, get everything they're supposed to get.
Right.
Not only that, we manage their emotions, because cancer is very debilitating. It's a long journey and it's not something you go alone. It's even more ravaging for relatives, because when you are taking care of a cancer patient, most times we even have the relatives coming down with, emotional breakdown and everything. So most times we even carry you along. So we carry along the patient, we carry along the relatives, we manage, we handhold you. We're telling you we're here with you, we're here for you, we're going to be with you, we're not going to abandon you. We also have a burden, because it burdens you, because, after a while you have formed bonds with these patients and you see them going down and it's affecting. It affects us. It affects us emotionally. Yes, emotionally. But we don't have anything. We are burden bearers. So we have to carry this burden, drop your family issues, and continue to ride on.
I'm just trying to put myself in your shoes as a nurse, and I can't even swallow it. Yeah. Well, I must say kudos to every nurse out there.
Yes,
but let's look at the process now. The process of how nurses at Rjolad contribute to a patient's recovery journey from the moment they arrive to discharge.
Okay, so the moment they arrive, remember, we are the first contact. We take your vital signs. If your vital signs are not even very okay for us, we do what we call triaging. Okay. So triaging, we express, we just give you an express, access to the doctor.
Okay.
Because by then we have seen that, no, this person is not somebody you need to sit down here and wait on the queue and wait for your time. So we triage you. So it is the nurse, because you have the knowledge. We have the clinical, knowledge. We have the technology to detect us, especially at Rjolad. So we triage you and we expedite. Everybody is savvy to that, so the doctors know. So the moment a nurse comes to you to say, this is what this, they immediately turn over to that patient and, continue treatment and start treatment. So this is our process. We are knowledgeable, we are skillful, we have the empathy, we have the compassion, we have all it takes, to give all this care all the time, every time with us. But we are not doing it alone, remember?
Right. Yes.
It's a teamwork. The doctors are there, the other people, clinical team are there.
So can nurses detect warning signs or changes in patients' condition, especially for cancer patients?
Oh, definitely. So, like I said, you use your clinical knowledge observations.
Right.
So when you are especially when you are administering some chemo or whatever, even in the radiotherapy journey, you are there. So you are there to say, no, this thing, the vital signs is going this way, is going south, and you need to immediately escalate. So we use our skills, we use our knowledge, we have the technology, we have a lot of, if you come to Rjolad, you see a lot of improvements. What you see abroad, most of us have gone there to see, is what you're going to see at Rjolad. So we are journeying to be better. Of course, we are the best secondary healthcare in Nigeria. So, and we are even aiming to be the best tertiary, because we're doing everything possible to get to that level. But we are using everything we can to make sure everybody that steps into our door, not only cancer patients, but everybody that passes through our doors, you're going to be taken care of.
Absolutely.
Yeah. Therapeutically, I don't know whether you've been touched by a nurse before. Have you?
Okay, we'll go on a break then. When we come back, we'll talk about that. Lagos Traffic Radio 96.1 FM. We're connecting with Rjolad this morning. And we're looking at the heartbeat of healing. That's the role of nurses in cancer care and patient recovery. You've been listening to the voice of Joyce Ikechi Mark. She's Chief Nursing Officer, Rjolad Hospital. All right, then quick traffic report. Okay, so we have this one. Talking about the situation around Ojodo Baja. Well, I hear that corridor has been cut off. We've been talking about it for quite some time now for vehicular movement. Recovery is in progress and traffic has extended beyond Baja. Okay, so it was a case of a 14-tire tipper transporting granite. It collided with an interstate bus and ran into the barrier, spilled its content on the road, and, well, boom, traffic and all that. But hey, it's receiving attention. Hands are on deck to restore normalcy to that corridor as quickly as possible. All right, so back to the conversation. But before then, let's look at this one that has to do with... Okay, we're just trying to figure out one or two in the background, but of course we'll let you in. Ekpe corridor still looks very good. Appreciable movement from Mojoda connecting Tamaru, Itaupu, Ayetoro, and it's a smooth one beyond Ayetoro towards General Hospital, linking the T junction, Temu, Okyosho down to K2, and beyond the T junction, we have also recorded fine movement connecting Alaro City, Okyo, Nkara Market, Eleganza, all the way to Eleko Junction. All right, that's just it for the Ekpe corridor. Of course, more in-swingers will be flowing in. You two can connect with us via WhatsApp on 0809 912 0777 or put a call through to 0915 387 7127. You can speak with my guest. She's the Chief Nursing Officer, Rjolad Hospitals, the person of Joyce Ikechi Mark. And we're looking at the role of nurses when it comes to cancer care and patient recovery. So let's talk about the job itself as a nurse. We understand every job, every duty comes with its own challenges. So what are some of the unique challenges nurses face? And how do you overcome these challenges?
We have, like I said, the major one is even emotional burden. Emotional burden where most times you see a patient that comes to you, the person is looking at you. Sometimes you feel like, how I wish I can just take this thing away, and you're very before the person will just, it will pass. It hurts you, and you are still the one that is going to do a last office. Last office is preparing the person, cleaning up, tying all those things. You are still this is somebody I was saying, hello, don't worry, you're gonna be fine and everything. You've given them hope, going along with them, and you're very before they go, and you are still the same person that will come and do last office, and you pack them and do all those things, cut, all those things that you do. So it's so painful. You get home, sometimes you can't eat, you can't do anything. And then you will still be the person to go and break the news to, the families and relatives. You'll be saying, he's going to be fine. Don't worry. It's going to be okay. Let's keep hoping and all that. So that is even the major burden for nurses. And then generally in Nigeria, the burden is, sometimes you don't have a lot of, technological know-how. You don't have the skills and everything. But luckily for us at Rjolad, one of the reasons why I even joined Rjolad it was then because I saw that they are serving with knowledge. They train you until you have a fatigue. So we train every week. There's no week we are not doing 2-3 trainings, and external, internal, every time we're doing trainings. So those ones, it helps us. But generally in Nigeria, what is a big problem? But we have the technology. You can have the technology and you don't have the skills to operate those machines or those things. So you're not going to do anything. But this is where we are different. So, and a lot of it.
So, we had cases where patients or even relatives of patients complain about nurses being rude and arrogant and the way they talk to their patients. Now, would you say this is a myth or a fact? And could it be owing to the emotional imbalance they go through caring for these patients? Or why is it so? Do you believe that?
Well, I know that there are different individuals and different professions have different people. So we can't generalize. So we have the same thing in nursing. But majorly, because of training, we are now trained to be empathetic, compassionate and everything. But I won't tell you that we don't have people that are rude. They may be rude even when they are bankers or anything. They could still be rude. So, but then it is not acceptable in our place. First strike, second strike, you are out of the gate, because we've been trained that patients are kings and queens, and we have to train them like that. So sometimes people misunderstand us, and they also need to know that there's a roller coaster emotions going on in the nurse. So this is the nurse, they are taking care of 5 or 6 patients. One is a cancer patient, the other one is a labor, the other one is pediatric. You have to switch between your brain to take care of what is this person going to do. You're going to manage this woman in labor is a unique thing you need to tell her. Then you go to that cancer patient, this is a unique person and you need drug, you need to calculate. This is a pediatric, you need to also calculate according to age and weight and all that. So sometimes people don't understand. I know everybody wants you to be there. Yes, we are there, but sometimes when I'm handling one patient, you all should understand that at that point I will come back. But the problem we have, other people used to have, which we have solved in Rjolad, is communication. So we let the patient know, I have other patients, but just give me a little time, I'll come back to you. So now we are now relating well. So that is how we have eschewed that kind of myth.
You have mentioned the word training several times during our conversation. So what kind of emotional intelligence or communication training do Rjolad nurses receive in order to support patients? Now, going beyond medical care.
So beyond medical care, we all have that 5 years in nursing school. So that's what you have gone there to learn, the skills and all knowledge. Then what are those things that will help you to go through to navigate in the world, the real-time world? That's that emotional intelligence. That's reflective practices. That is the self-awareness, self-consciousness. How can I manage my own emotions, hold it down, and be able to manage that of others? How can I communicate well? Like what I was saying. Yes, the patient doesn't know that you have another patient. So I need to communicate. I'm sorry, I need to quickly, like all the things I was saying, triaging. I'm sorry, this baby is having a fever and I need to, otherwise he's going to have a convulsion. But the moment we've realized that the moment you communicate effectively with patients, they understand. They will even support you to take care of all those, even patient relatives, especially in Nigeria. We love ourselves when there's crisis and chaos. You will see them patient relative from another patient running to come and help. Madam, what can I do? No, can I bring water? Can I? But problem we have most times is that we don't communicate well. So the patients now begin to imagine. And yes, you feel abandoned, left out, and they don't know what is happening. And they'll start attacking you. But we have been able to. So thank you to Rjolad. Thank you, Afia Care.
So in your own view, as the Chief Nursing Officer at Rjolad, now what what are the misconceptions people have about the nursing profession, and how can we change the narrative?
Okay, like I said, the misconceptions that nurses are wicked, nurses are rude. Nurses are not wicked, they are not rude. They are just emotional people that have emotional burden of different people that needed to switch their emotions and clinical skills from one disease condition to another, from one treatment to another. But then nurses also need to tell themselves that they need to, learn more. They need to communicate more. All right. So that kind of a thing, that's a myth. Is not who we are. We're not like that. We are very compassionate. We are empathetic, because you need to feel what people feel, see what they see, hear what they hear, so you will understand. And every time I tell my people, I tell my nurses, there's always what we call law of karma. It's always, because we are under oath. When you join the profession, we took an oath that we're going to do that. Everybody, all the medical, we took an oath. It's written there. And so under that oath, I remind them that you're under an oath. So if you don't up your game and all that, the karma may come back to you, and you will feel it when your relatives are here. Will you want to be treated? Will you want your mom to be treated the way you're treating somebody? Then do the best things. So
is nursing now? I'm going to ask the question. Over time, does it become a lifestyle, or does it just end within the hospital? So when you're home, you're a different person, and when you're back to the hospital, you start showing care and compassion. So does it become a lifestyle over time? That even outside the hospital, you behave like a nurse?
For me, it is a lifestyle. Because I don't think I want to be any other thing but a nurse. Because I've gone out so many times on the road and I see somebody trying to push out the baby. The instinct is that, hello, madam, everybody come around, bring your wrapper. We cover. I've taken deliveries up to 2-3 times in this Lagos and on the road. And that's your instinct. So I've seen somebody collapse on the road. I'm like, hello, I'm BLS, Basic Life Support. I'm an instructor. I'm this. Please, can you please do this? Can you give away this and that? We need to do this. You do that. You do. So it's a lifestyle.
So it goes beyond the 4 walls of the hospital. It goes beyond
the 4 walls of the hospital. You have to. I've been in my home several times, and the other neighbors, they are screaming and everything. My child, I ran off. And I had to go there and I rescued that. So it's a lifestyle.
Wow, it's been nice having this conversation with you. It's quite an eye-opener, I must say. Yeah. So where is Rjolad located? Rjolad Hospital.
So Rjolad, like I said, we are the best secondary healthcare facility in Nigeria. This 2025, and we'll continue to do that. And then we are located at the Bagada, which is headquarter. We call them hubs. The hospitals, we call them hubs.
Spread across Lagos.
Yes, we have at Agege, at Salem House. We also have at Isolo 7 and 8. We also have our spokes like express clinics at Jaramo, Pensinema, Bawala, and all that. So we're everywhere. We offer every services.
So can patients reach out to Rjolad?
Yeah, you can reach out to us at on our website at www.rjolad.com. www.rjolad.com, or you can send us email at care@rjolad.com.
All right, so finally, before I let you go,
can I call the number?
Oh, yes, please.
Okay, so you can reach out at this number 07000 756 523.
Let's take it again.
07000 756 523.
So what should be your final message to my listeners? You have just 10 seconds.
Okay, my final message is please come to Rjolad Hospital. We care. We care for you. We care for your relatives. Please come and let us take care of you. Please come, let nurses touch you. Please come. We're going to handhold you, and we're going to do the best for you. You're going to come back. It's heavenly.
I would love to feel that touch.
Please come and feel the therapeutic touch of a nurse.
Thank you so much for being here this morning.
Thank you so much.
Lagos, you've been listening to the voice of my guest, Joyce Ikechi Mark. That's Ikechi Mark. She's Chief Nursing Officer at Rjolad Hospitals. And I've been talking about the role of nurses in cancer care and patient recovery, the heartbeat of healing. Thank you so much for being here. Lagos, we'll go on a break. When we return, we'll be delving into the next segment. And of course, we'll continue with the conversation. Stay here.
Hello, everyone. This is Tony Adibola. I'm an entrepreneur and a motorcycle enthusiast.